Hi, can you hear me?
Yes.
Yes,
Okay, great. Thank you.
and thank you for coming at the last minute, Julie.
No, thank you so much for having me. I won't be able to join on video at the airport, so some
Okay,
technical difficulties.
okay. No worries. No
Thanks.
worries. How long do you have to stay, though? Just curious, because we can start with you with your announcement.
That would be great because
Okay,
it would be great if I could get out of here in 20 minutes to go to my camera roll.
okay. You got it. You
Okay.
got it.
Now I'll be quick too.
Okay. Okay, I'm just gonna give it, it's 5:59 anyway, just give it a few minutes for people to show up.
Okay.
Hi, Melissa, welcome.
Hello.
Hi, hi. Nice to see you. And I don't want to say face to face. I don't know if that's
Quasi
what you would call
person.
it. Yeah. Um,
Ah,
we're just going to give it a few minutes for more people to show up, and then we're going to actually going to, Amparo, we're actually going to start with Julie Chu has an announcement. She can't stay for the entirety of the meeting, so she just has an announcement to make, and then she can go. But we'll wait. We'll give it a few minutes for a few more people to show up, and then we'll
wonderful.
get started.
I'm gonna apologize in advance. I might actually turn my camera off, which I never do, but I'm having a back issue today, so I might do this meeting laying down. Okay.
Understood.
So I'm not being rude.
Okay, understood. And do you need hosting privileges or anything?
I don't think so. I was just gonna
Okay.
talk. It's okay.
Okay. All right. Okay. Okay, so let's get started. And I want to be mindful and respectful of people's time. So welcome everybody to the September meeting, 2024 meeting of the Health, Human Services, Education, and Unhoused and Shelter Committee. So welcome everybody and welcome to our new time of 6 p.m. So we're going to do this a little bit out of order. I think it's going to be, I don't know if we'll call it new business, but we're going to start with an announcement from Julie Chu, who cannot stay for the entirety of the meeting. So take it away, Julie.
Thanks, Lauren. Thanks for having me tonight. It turns out there's a public hearing next Thursday, the 19th at 10 a.m. for a bunch of public bathroom bills. One of them is Intro 0694 that was reintroduced last year. It was proposed by Councilmember Nurse last year, but they never had a public hearing for it. It's a really exciting bill where right now we have 1,000 public bathrooms in our city, and this bill is proposing a ratio that will get us to 4,000 bathrooms. And what's really great about this is it's going to involve strategic planning. So DCP would head this with the Office of Public Realm, and they would look at public bathrooms holistically. I know there's been some public bathroom bills coming out where they're, looking at parks bathrooms or opening BCAS buildings, but this one's going to start where DCP is going to, strategize how to create more bathrooms and look at it in multiple ways. That's going to address maintenance, address safety. So I think this is really important. And I think this is something we would love to get a letter of support from CB2. And it can be after the public hearing because the 19th is just a week away. But I think Coalition for the Homeless, as well as Local New York, they're coming together to build a coalition to show up for the rally at 9 a.m. next Thursday, right before the 10 o'clock public hearing. And a lot of them are that have joined the coalition is doctors and medical groups, because they're really looking at this from a public health point of view. So they're trying to mobilize people to show up at 9 a.m. If you guys would like me to, I'm happy to send you more info or connect you to Coalition for the Homeless. If you have questions about the bill, I'm happy to answer it. I tried to reach out to Ryan Hickey from Councilmember Nurse's office to see if he could attend, but it was too last minute. But if you have any questions about the bill and if to figure out whether you want to support it or not, I'm happy to answer it. I've done a lot of research for this bill. I have a publication coming out the day of the public hearing that's going to support and show kind of the strategies the city can look at.
Okay. That sounds. I'm sorry, go ahead. I'm sorry I interrupted, Julie. Go ahead.
No, I'm happy to take any questions.
Okay, and we have a question from Amparo.
What is the bill's specific name or number?
0694, and it's called Citywide Long-Term Citywide Strategic Long-Term Citywide Bathroom Strategy. Can I share screens here? 0694 Long-Term Citywide Bathroom Strategy. And the Committee on Governmental Operations, State and Federal Legislation, they're the committee that's hearing it next Thursday. And I think Councilmember Ressler is heading the committee, chairing the committee.
Okay. And then the rally is outside of City Hall? Like where is this?
Exactly.
Okay.
Yes, right outside the usual. And yeah, I just wanted, public bathrooms have been overlooked for 3 decades. They've been trying to provide them. And now that we have a public health crisis, a pandemic, I think they're really prioritizing it. And hopefully this will pass and they will really look at this issue more in depth, more holistically.
Okay. No, that sounds good. And you said that if we do a letter of support, it can come in. What's the deadline then? Because you said it can be submitted after the hearing.
Yes, it can be submitted after, and I'm happy to send you a reso that Manhattan Community Board 5 wrote last year, and I'm actually writing a testimony for CD5 for the public hearing that I'm also happy to share, just some text, some background and verbiage. that could maybe help with if you wanted to write a testimony or a reso letter of support.
Okay. Oh, okay.
Okay.
Sounds good. Yeah, we'd appreciate that, Julie, as
Okay.
always.
Yep, I'll send that
Okay.
over.
And thank you, as always, for keeping us updated and posted on what's happening with this stuff.
No, I appreciate you guys listening and wanting to support public bathrooms. It's so appreciated.
No, it is important. I know we've talked about that before, but it's also, it's like, you know, people go out and it's like, you do always have to think about it. Like when stores close, like now where do you have, what access do you have? And so it's like, you're just trying to plan sometimes,
Exactly.
you know?
Yeah, and especially since OIC rezoning is happening soon, like this whole
Mhm.
swath of area, which, you know, I know they don't have bathrooms over there. If DCP was involved, they would start thinking, where can the bathrooms go when this area becomes even denser? If there's
Mhm.
park space, making sure that those parks have bathrooms. So this bill connects with all of rezonings that will be happening across our city.
No, that's true. That's true. And I like the fact that the bill that you're talking about, like, also considers these other things, maintenance and everything else like that, because it's no point, you know,
Right.
installing bathrooms and then letting them, you know, go into disrepair and everything else like that, creating other issues. So,
Exactly. Yeah, we don't want to create bathrooms and then it becomes major. Yeah, it definitely has been problems in the past, and we have to solve for it in a way that is designed well and maintained well.
okay. All right. Does anybody have anything else they want to say, add, or ask?
I just would urge us to, I guess, should we make a motion to
Yeah.
write the letter? of
Yeah,
support?
yeah. Do you want to make a motion? Does anyone want a second?
Sure, I'll make the motion.
Because and what do you? I mean, this is the thing. Because I think we could, because come out of committee. I don't know if we necessarily need to go to the whole board, but we could. Like, I don't know. It seems like you also have like, yeah, I don't know. What are your thoughts, Warren?
We can make a motion here
Okay.
to support it. I don't think we need the whole crew.
Yeah.
Yeah.
Same here. Okay. So Amparo, you made the motion. Does anyone want a second? Warren seconds. Okay. And then, okay, I don't, okay. So it's show of hands, I guess. I do. Okay. All right. So we'll take care of it. Just send us what you have, Julie, and we'll take care of it. Okay.
Okay, I'll send you information about the rally too, if you
Okay.
guys can attend
Excellent.
or
Which
forward it to people.
yeah, I think somehow we should announce that though at the, I'm not going to be at the community board meeting this Thursday, but I think we should make an announcement that that's happening in case anybody else there wants to attend.
I'm happy to make that announcement on our behalf.
Okay.
May I add something?
Sure.
It may be related, not related. So I was in Europe the last couple of weeks in Spain and France,
Mhm.
and I was out a lot, and having access to public restrooms was very
Wow.
important. I know this is New York City, it's not Europe. I know they do things a lot differently than they do here, but for myself, I was very appreciative of public restrooms. They were well maintained, so that is very key on where we put them at, and that there's maintenance of them. Most of them were automatic clean, but they did have people who regularly check them. But I'm supportive of it. So
Okay.
if it means anything.
Okay.
So these
It
were
does.
freestanding bathrooms on the street or near the parks?
Yep. Yep, that is correct. That is
Wow.
correct.
That's great to hear.
Okay. Thank you for that, Warren.
Thank you all.
Okay.
Take care.
Okay. You're welcome. Take care.
Take care.
All right. Thank you, Julie. Okay. And then, okay. All right. Okay, Melissa.
Hello. Thank you so much all for having me here today. I'm sorry again, I'm literally laying down, but I don't know exactly how much Anatole told you, but I had reached out for specific ask. related to the New York Health Act. I don't know how much the three of you all know about the New York Health Act and what it is.
Yeah,
Go ahead.
feel free to tell us and inform us. And then also, this recording is also, that's made available to the public, so that you're also informing the public, whoever, decides to access the recording later on. So yeah, please feel free to enlighten us.
Wonderful. Okay. Well, a little in short, what the New York Health Act is it would be a state universal health care system. It's a bill in New York State right now that, if passed, would guarantee high quality health care coverage for all New Yorkers. Again, this is statewide. And what I mean by all healthcare, it means it is a healthcare plan that would include dental, vision, hearing, mental health, maternal health care, reproductive health care, long-term care, and even substance use treatment. A little brief history of the bill itself, just to give you, it was initially conceived and brought into the New York State legislature as a bill in 1991 by the Assembly member Dick Gottfried, who some of you might know, he recently retired after a 50-year term in the state legislature. And it actually passed in 1992, a year after, and the Assembly never made it to the Senate. It passed a few more times between 2015 and 2018. And it gets close. There's a lot of support for it. And I have been, I personally, I was just a citizen like the rest of you, a constituent of New York State. I am also by profession a healthcare worker, a midwife in the state for the past 17 years. So I have a lot of different perspectives on why I think this bill should be passed and made law. And so I've been working with organizations on this for like the past 6 years or so. Specifically today, I've been working with the Physicians for a National Health Plan. That's a national plan, but there's a New York Metro chapter that works specifically on advocating for the New York Health Act. I was reached out to them, me and another neighbor of mine here in CB2, who again also has been advocating for this bill. And we want to plan a town hall with our state senator, Michael Gianaris, who has also again been a co-sponsor of this bill for many, many years. And what we'd like to do is, again, to bring more awareness of it, is have a town hall in his district. It's possibly even going to be here in CB2, to bring, again, just even more information than I'm bringing you right now to the public about the bill, to answer questions, for people to give some opportunity for testimony about why this bill would mean something to them and why it could be transformative to them. So my short ask for you all is, if you were interested in some capacity, other just sponsoring a town hall, that is an opportunity for people to discuss and learn more about it. Our tentative date, we still have to confirm everything, is we're looking at October 20th right now, around 3 p.m. That could change, because we really are aiming for a Saturday, to be honest, but we're having some location issues. We found a location for the Sunday.
Okay.
But that's what we're tentatively working with right now. Any thoughts or questions right now before I continue?
Does anybody? No, feel free to continue.
Okay. So again, I think a sponsorship, the bare minimum, would be fantastic. That would basically include logo and any kind of signage and any kind of information and word spreading, word listing, people who are interested in being or are signed on to be co-sponsors. Currently, hang on, I'm just pulling up the list here. We have Woodsign on the Move has agreed to co-sponsor, several healthcare organizations, NYSNA, most specifically the New York State Nurses Association, which I have to say is that union is one of the organizations that actually worked on the bill creation in its inception with Assemblyman Gottfried. Also, maybe some support also helping us promote it, just by through your resources, telling people about the meeting, when and where it is, so that the public knows that this meeting would be this town hall would be taking place for attendance. as a sidebar on a whole too, as a constituent, I would say it would be lovely is if there is enough support amongst the community board to even write a memorandum of support for the bill in the legislature. That would also be quite wonderful. I know some areas in New York, I don't necessarily know about the community boards, I'll admit, but have done things like this. I actually have attended there's been some like public hearings about this, like with the joint health committees of the state and Senate over the years. And I saw the comptroller of Albany actually give a presentation in support of it as well. So I know there are like different kinds of like city, like different like city municipal entities that have made these MOSs before on the state level.
What's the status of the bill right now and how many sponsors do you have? I'm curious. Do you know?
Oh, that is an excellent question, because right now it hasn't been reintroduced yet. It's going to be
Okay.
reintroduced in January.
Okay.
I will say this, every year it gets a vast majority, because we have this like supermajority of Democrats in the Assembly and the Senate, and it does have a majority in each one. I will say what I think the biggest thing is it's overwhelmingly is easy to pass in the Assembly. The Senate just has a harder time always making it to the vote stage. In spite of having, there is, I think, maybe like either the majority or maybe one shy of majority every year of co-sponsors. Yeah, but I obviously don't know this year because it's not going to be introduced again until January.
Okay. Okay. Did you have more to tell us, Melissa? And did anybody have any
That's
questions?
really it right now. I just open up to questions or thoughts.
Okay. Amparo.
What is the bill number for the New York Health Act?
It changes every year when it's introduced. Give me 1 second and I can pull up what the most recent one was.
Okay.
Great, thank you.
Yeah. Okay. Oop. Sorry. I have it like physically sitting in front of me, but I don't see the number on it, so I got to look on the internet. Sorry.
Okay, no worries. Take your time, Melissa.
I admit it's a little hard because it has been reintroduced for so many years. There's many different numbers associated with it.
While Melissa is looking, I just wanted to mention that I think that this is something that we could definitely try to put together a memorandum of support for the bill. And I think we can definitely promote the event too. I don't see why we can't, tell folks about the town hall.
Yeah, and I agree with telling them about the town hall. I'd want more information from the town. Like I'd want to get the information from the town hall, or you know what I mean? Like I'd like more information about the whole bill. Before deciding about the support. I guess that's what I was thinking more so. I'd want more information about all of this. Compared to the public bathroom thing we've been hearing about, you know what I mean? Like I just feel like, yeah, like we do our due diligence.
Absolutely. I do have the Senate number from the 23-24 General Assembly. So it's S7590.
759.
Yeah, that's the Senate one. I'm sure there's another one for the Assembly, but
Okay.
That's what I'm looking at.
But I agree with you, Amparo, about like promoting it, because I think the community needs to get as much information as they can about all of this, and then hear about it. I had a question. Where are you? Okay, so where are you advertising though, or plan to advertise? Let me say, when you do have the like, how are people finding out about it otherwise?
Yeah, I mean, good question. It's going to be obviously a large social media front. We're
Okay.
looking into that too and getting some support for how that's going to be published. Let me scroll down to our last meeting notes. I mean, it should be anything from our local entities. Obviously, we're going to ask the senator to promote it through his means. There's our local organizations, like even through our Facebook groups, like the Sunnyside Woodside Action Group, like SWAG. There's also, we're looking for support from some of the other like local clubs, and not just here. Again, this is across his district. So his district now expands across like Elmhurst, almost like touching like Rego Park for a bit too.
Okay.
So we're looking out in that area as well to
Yes.
get people interested just to come, to come and see
Okay.
and learn. Also trying to reach out to even more and more like local community organizations. There's a few we still reaching out to and haven't gotten back from yet.
Okay.
But also like the Western Queens CLT. I know that the Hope Astoria Church said they're open to spreading the word as well.
Okay.
So yeah, we're trying to reach out, cast a wide net, you know.
Okay. No, it sounds like it. And then like you said, so but you haven't like nailed down the location exactly. I'm just wondering
I'm
like how
99% sure. It's just we wanted to try and find a way with Saturday availability.
okay.
The
Okay.
short story is we were trying to use the local Sunnyside Library with their booked, and they're trying to help us find another location.
Okay. No, I'm just because what I was wondering was more about like how like what's the capacity, the size, the
Oh,
seating
yeah,
size.
yeah,
So like, that's what I
exactly.
was wondering because it sounds like yeah.
Yeah, I mean the current space. I mean, and that's the problem is like Sunday we've got a decent space. I think if we do it on Sunday, I think we're able to use the All Saints Church, you know, over on 46th Street, which is a decent size. But
Okay.
then like on Sunday, we're also some people can't do Sundays because they got
Yeah.
like life and other things going on preparing for the
Yeah.
week. So, you know, so full disclosure, we might switch to a Saturday if we can swing
Okay.
it, but it seems like it's gonna be sticking to this Sunday.
Okay.
I can't find the raise hand function.
Oh, don't worry.
Lauren.
Yeah, that's fine. Just you can just raise that. That's fine.
So good to be here. And Melissa, I'm sorry that I missed the earlier part of your presentation on this. Is there perchance a one pager that you're using for briefings on the bill that you can share with us?
I don't specifically have one, but I would say to anyone who is really interested in learning more about the bill, my favorite place to go and just get this kind of quick information, I tell people to go is to nycampaign.org. So that's the New York, or the Campaign for New York Health. That's really the organization that's been doing a lot of the organizing about this. You could also go to Physicians for a National Health Plan, but that's a more broad one. You'd have to go to the New York Metro chapter and all of that. But if you go to newyorkcampaign.org, it really lays out like the details of everything I'm telling you now. It gives a bit of statistics. It cites this study called the RAND study that talks about healthcare costs and how not only, by the way, does New York Health Act give everyone coverage, but it would actually save all New Yorkers roughly 4%. So there's some other really elegant information on there as well. That's where I would direct you.
If you can, would you drop the link in the chat? I don't know if it's me or if everyone's having the same issue, but it's not showing up for me. So it'd be good to have the direct link.
Oh yeah, I'll totally drop it in right now. I'm typing it.
Thank you.
So I'm having an autocorrect problem. It keeps on trying to change
it's-
as I type it. This should be, see if this
Okay.
one.
But there's no H, right? It's NY campaign, no H,
No, it's
right?
NYH. I just realized
Oh,
I think
it's
I told you
NYH?
NY campaign. Yeah,
It's NYH. Okay.
yeah, it's NYH. That's what I just realized. I think I told you the wrong. I forgot the
Okay.
H. Sorry.
Okay. No, that's all right.
That's why we type and we don't talk, right?
Okay. That's all right. For more information. Okay.
Yeah.
And how long are you expecting the town hall to be? I'm just curious, as long as it goes like Q&A or like just curious, how long?
Yeah, I mean, it's probably, we're saying like an hour and a half.
Hour and a half.
Truthfully, don't know how long the senator
Mhm.
can stay for it
Mhm,
because he's
okay.
got a lot of other responsibilities.
Uh-huh.
But we're gonna have a bit of time this indoor talking about the bill, a bit of time for people to sort of testify a little bit to the public about why this means something to us. We're gonna have like a short sort of panel talking about the bill and why it means something to them to see it pass. And of course, the senator will be available to answer any kind of questions people have about the bill, where it stands. A lot of the questions we're asking right now, like what's it going to be like in January when it gets reintroduced? What can we do to help? And things like that.
And you said you were looking for sponsors for the town hall as well? I mean, so what kind
Yeah.
of, okay.
And it's not necessarily like a financial thing or anything. It's really just more about putting your like name to it, like saying that community board too, like is supporting of this event,
Okay.
Yeah, and if you can, again, like, you know, I don't know what you can do, like through your website or any other kind of like resources that the community board has to spread the word. That would obviously be wonderful as well.
Okay. And we have our newsletter. I don't know, and then I don't know how, I know like, and I guess a flyer or something. I don't know. And I don't know what like the protocols are for CB2 sponsoring an event. I have no idea what anything about that. So but we can ask.
Okay. All right. Any other questions or anything?
No.
I love the curiosity.
I do too. I love it. I love it. I love it. And kids raise their hands. They want to participate.
I did an event once. We had like was like some like street fair, and we were tabling for the New York Health Act, and I had a button making machine where people could make their own buttons saying why they wanted New York Health, and like the kids wanted to participate. And this one girl wrote like, "Because I want toys or something like that." And I was like, "Well, if your family saves 4%, they could buy you 4% more toys." Sure, I'll take it.
There is a connection. There is a
Something for
connection.
everybody. But if you want to look into what a sponsorship would mean, entail the logistics for CB2, I mean,
Okay.
obviously go ahead, take some time with it. You guys have my email. You could get back to me.
Okay.
Any other questions? I'm always available.
Okay.
Okay.
That sounds good. Thank you. I appreciate it, Melissa, especially
Wonderful.
since you weren't feeling well today.
Well, there's all the more reason for access to healthcare for everyone, right?
Okay. There you go.
All right. Take care, everyone. Have a good
Okay.
night.
Take care,
Thanks,
Melissa.
feel better.
Thank you. Bye.
Okay. All right. This looks like it's gonna be, I guess, okay, so that's it for presentations. Oh, and Nellie, before you arrived, we made a motion and we took a vote. So Julie Chu came and was talking about the public hearing next week at City Council about the a public bathroom bill that would that what is it, DCP would have to like figure out planning for it, maintenance and everything else like that. So it's but and there's supposed to be a rally beforehand. So she was talking about like what we voted on was to do a letter of support, which doesn't have to be submitted before the hearing, which is on the, what'd you say, the 19th?
19th, yeah.
19th. But something that we thought we could do as a committee. And then Amparo's planning on making an announcement at the full board meeting about the city council hearing. She'll make an announcement. I'm not going to be at the full board meeting this Thursday. So
Okay, but city council is in support. Yes? Do we know what their position
they're
is?
just holding a hearing. They're just holding a public
Oh, they're just holding a hearing.
public hearing on it. That's it.
Okay, thanks for that. And just
Yeah.
curious, did I miss Melissa's sort of overview as to what the engagement is with the city? Like what is the, you know, city's position? Is the health department engaged? Like why are they coming to community board too? This feels like are they going to every community board?
They're having a town hall meeting. That's what the original, when she had reached out to Anatole about this stuff, and that's really what it was just about announcing a town hall meeting. Like she wanted, and that's all, and which I think is really all that we should be committing to is like, and you know, at this point, because without further more information about it, yeah. But
It's with
that's really,
Gianaris's office.
I'm sorry, what did you say, Amparo?
I just want to make sure that Nellie knew it was with Gianaris's office.
Yeah. And that's it. That's all they were trying to do. We're trying to get like, yeah, the word out about it and then a sponsorship of the event.
And if you want to know more about the support and the bill itself, you can go to nyhcampaign.org, and it kind of spells out what the actual bills that they're asking us to take a look at support.
Thanks.
So I think it's, I mean, something that we can also, I mean, like revisit, like I would just like to, I mean, depending on when this hearing is, I may or may not be able to attend, but I would like to, I think we should have more information as a committee. That's all. We're taking a position. Okay, new business, old business, I don't know. Like, I'm gonna give people back their time.
I will say real
Sure,
quickly,
Warren.
I did reach out to our contact at DHS, Mr. Samuel Clark. He's out of office until the 16th. So I wanted to touch base with him, and then I had some questions regarding the migrant shelters and what the mayor is doing. And I wanted to get a little bit more clarification. So once I hear back from him, I'll let everyone know if there's a meeting that we can have with him one-on-one, or even just myself. And I'll have a few questions, and I'll relay that information back to everyone here if no one else comes in attendance. I did reach out to the permanent shelters here in North Star and their sister family shelter in Woodside. I can't remember the name off the top of my head, about having our CAB meetings with them sometime in September, October, and I'm just waiting for them just to reach back around and give us tentative dates. And once I know, I'll reach out to you guys if you want to attend.
Okay.
All good. If not, same thing. I'll just
Okay.
put the information back to everyone. It's all good
Okay.
because I do them anyway.
And
All
and
good.
thank you for that, Warren. And then when you get the dates of the CAB meetings, can you like have the Debbie send it out to the committee members so we know, and then you don't have to wait for like the meeting itself. And then because especially if those CAB meetings precede our next HHSC meeting, so that'll be good.
I'll let you know. Thank you.
Okay, no, appreciate it, Warren. Thank you for your work with all of that too, and your diligence, because yeah, appreciate it. So, do want to okay, so just keep a lookout for the dates for our October and November meetings, because we have holidays the second Mondays of the month, both for the next 2 months. So our meetings will be rescheduled. And what we're looking at now is and we'll let the board know, we'll let the Debbie know, we're thinking like the third Monday of the month. It just easier to just keep it on Mondays. That works for people.
Lauren, I'm curious now that we're back in session and thinking about the year ahead. How do we, and this is my first time sort of being at the beginning of the year. How are we thinking about like priorities for the committee? So that we're like more in a proactive, less of a reactive mode. Like, are there things that we, want to lift up and focus on? How do we sort of think about those things?
I mean, we can propose it at these meetings. So, I mean, we've done that in the past where we've had like sort of like planning type sessions or planning components to the session. And so I think that would be good. Right now, I mean, I know when we just started, we sort of was like, it is more like responsive to some pending things. Like there's something that we're trying to respond to, like with the capital and expense budget. So that may also like determine who's going to be at this next meeting, depending on how that goes, the October meeting. But yeah, no, that is something that we should be thinking about. And so, yeah, we can talk about that now if you have any ideas or thoughts about where things are going. I know the issue that Warren is talking about is like very much what should I say? It's a prevalent, like it's very, very, because a lot's happening with that. So that's something that we definitely want to stay on top of, all of that.
Yeah, I don't say this with an agenda myself.
Okay. No, but it's something, but yeah.
Just curious about like how we should think about, the year ahead. I know there's things we'll always have to sort of be responsive to. But thinking like, is there like one or two things we want to think about as like putting some like continued effort behind. And I know your point about what Warren has raised, like that we should think about that how can we support that, of course? And then if there's like other things we want to be lifting up and thinking about, looking into, just curious.
Okay.
May I add something? It
Yes, Warren.
may not be related, but maybe so. There's been this initiative maybe for the last few months about the One LIC. And in these discussions, I yet to really hear anyone discuss about hospitals, state or even local hospitals being built along with schools. And hate to say it, but under Cuomo, Governor Cuomo, he closed out so many hospitals statewide. And now a lot of these public hospitals aren't available in areas where they once were, Brooklyn, Bronx, definitely here. And they need to be built. So maybe something we could pick it back as this thing grows. It's already, towards the end of the One LIC, LIC, One LIC push, but public hospitals should be a priority, especially if it's in our neighborhood, community board 1 and 2. So
Right.
I'm sorry, maybe I'm lost and not hearing these things, but
No, you're absolutely right. And that is something that I think that we should be pushing for. And that's something actually that should be, like, it was, I didn't see, like, we had a meeting last week about the one, like a response to like the One LIC, and somebody brought up the thing with hospitals too. So that's supposed to get discussed at the Thursday meeting. So I think if and hopefully they got added. I didn't see the edits, but that's something that should be raised again, because you're absolutely right, Warren, about all of that. And I know that's also been an issue that's been important to Danielle too. So it's like we should be pushing for that. Absolutely. And it's infuriating to see all of these public hospitals closing and whatnot, not just in our, we live in like a hospital desert in our community, but in other places as well, like in Brooklyn and it's like, yeah. It gets treated like hospitals are obsolete, and it's like, how can a hospital be obsolete? That's definitely a problem. One of the things that we've been trying to do is like, but I guess it's premature, is like this Northwell nursing school that they've been trying to open. They want to open in Woodside. That's something that's like on our radar, that when things are a little bit more settled, we want to have somebody come and speak about that. We had tried to get somebody already, but I think they're still at the point where they're trying to find a leader for the school. So, but that's something that's on our radar that we want to do that within this next year, hopefully.
Warren, I'm glad you brought that up, because that's been on my mind in reviewing the comments, for example, that were just sent around, because I know this is the last week to submit comments. I think beyond hospitals and like treatment and care, I just think there's like not a lot of mention of like public health considerations. So like, of course, some aspects factor in bike lanes, walkability, but then of course, like there's nothing about like, availability of food and like markets and, other things that, air pollution, like all of those things. So it's been on my mind, and I was actually going to send in some comments back about making sure we include something in our draft comments. So I hope I get to that. I don't know if Warren, I think there'll be other opportunities to do that, but I was going to send in some quick notes.
No, you should. And if you can do that in advance, because I know they want to make sure the meeting moves along on Thursday, so send it in advance. But yeah, for all of those considerations, absolutely.
Yeah.
But like I said, somebody had brought that up at the meeting last week because of the chairs, not that it was a joint meeting with the land use, transportation and the environmental committee. But yeah, somebody the hospitals were brought up. But yeah, anything else that you see as a public health concern, definitely feel free to raise it. I had another thought and I don't remember what it was, sorry.
Every one of you and your ability to influence things around you, because everyone who has people, whether it's family, your friends, your coworkers, or in your school, who trust you, listed.
Oh, I know what it was. It was a food pantry. There was something too that we're supposed to be following up with the board office that came out of like the capital and expense budget meetings too, about a community food, like scheduling a meeting with certain providers about a food pantry in the community. So,
But you did follow up with the district manager's office.
yeah, I did. I said, I
So,
asked when,
let's make sure
yeah.
that's on record.
I did send out an email asking when can we meet about it, because that was the ask, that was made by Kat when we were doing the capital and expense budget, something about scheduling a meeting with Woodside on the Move and some other orgs about that, about having a food pantry. And I don't know, Warren, if that's something that you would want to be part of the discussion too.
I will. I know we have a few, like St. Raphael's does food distributions. I wouldn't say there's one in Woodside, La Jornada, which is really big. They do it. Community Board One, there's Evangel Church. I work for a company that does these things ourselves, Queensbridge and Astoria Houses. So yeah, I'm all in. It's not a problem with me.
Okay.
I just didn't know where the conference. I didn't attend that meeting.
Yeah,
but
it came up and it was listed. I don't think I was at that meeting. It was like, but there was an email sent out about the asks, and that was the ask that was made of us, of our committee, and then you know, coordinating with
know that what I am saying
Debbie.
is
So,
true.
but
It's
I
up
was
to
just,
us to
but my
stand
question
up
to Debbie too
to
was
the
whether or
world.
not that was something that's an
Remember,
like a
we can
separate
make this
conversation, or
happen.
something, or if there's somebody
We
that
the
we can
people
invite
make this
to
happen.
the
This
to
is
our
the
committee
Power
meeting
Fail
to
Initiative.
talk about that.
You can take
So,
it now on November 6th.
so can keep you posted on that.
I don't know if we have a connect with HRA. They do what they call Community Food Connect. So they supply the funding or grants for organizations to get food through them, and that's HRA, which is a New York City I don't know what's HRA. I forgot the acronym, but it's a city agency.
Okay.
I'll look at them on it on my end as well.
Okay. All right. Okay, and I want to thank you, Nellie, too, for just reminding the proactive part of things, because I agree with you. It's like we don't always want to find ourselves in a position where it's we're taking a responsive, reactive stance to something. And we also want to stay relevant to the issues that are happening in our community. So we'll keep all of that in mind going forward. And then maybe we can make space at our next meeting to talk about more strategic planning type stuff.
I think that's a great idea, Lauren.
Okay. Okay, make sure that's on the agenda. And if I forget, remind me, please. Okay. Does anybody have anything else they'd like to add or discuss or comment on? Okay. All right. Thank
Should
you.
I make a motion to?
Go for it, Amparo. It's what you're
Motion
known
to
for.
end the meeting. Adjourning.
Okay. Does anybody second?
Second, thank you,
All
and I have to
right.
run.
Okay. Have a good one, everyone. Take care. Okay. Bye.